Hello, I'm Dr. Jake Porter, and I'm the founder and president of Daring Ventures Counseling, Coaching, and Consultation. And today I want to share with you an interview that I did with Carol Ann Manner, who is really, other than me, I think the longest standing team member I had at Daring Ventures. She's been with us since we first started, since our very first day, actually back in 2017, I believe. We're very close to the first day. I've learned so much from Carol Ann. She has a sharp clinical mind, and she ends up getting many of our most difficult cases at Daring Ventures. And that's because she's a real problem solver. She's an investigator. She is driven by data and evidence-based methodologies. And she introduced me to a way of looking at expanding the treatment for sex addicts and for betrayed partners that has proven through many of the complex cases that have come through Daring Ventures to be incredibly important. Just to kind of share with you one quick story, not really a story, but a scenario that's happened now several times over within our practice. And that's the client who comes in, and let's say it's a male sex addict, and this person has been to 5, 7, 9 different therapists. They've tried many different things, but they're not getting and staying sober. And so there's something else going on besides mere sex addiction, most likely. And what Carol Ann Manner has taught me is about looking at people's biotemperament. That's a genetic reality of each one of us. We all have a biotemperament that makes us lean toward being more over-controlled or under-controlled. Looking at that biotemperament and not just working on the sex addiction itself, but treating underlying issues as they relate to biotemperament specifically, but other factors as well, which could be trauma, depression, anxiety, personality disorders. And when this component was added to the mix of these really complex clients who had historically been labeled treatment resistant, what we actually started seeing was that they were getting better, and not just getting better in terms of their acting out behaviors, but also in their relationships and the experience of relationships that they had with others. This has also been true of betrayed partners who have gone through typical betrayal trauma treatments, but remain more elevated in their trauma responses. They get into these therapies that are congruent with their biotemperament, and we see incredible progress. So this is exciting stuff to me. I wanted to make this information available for free to as many people as we can, both clinicians and those who are looking for help, because we think that it can really bring a lot of relief and healing to individuals and to couples. So we're going to be talking about biotemperament. We're going to talk about the treatments that come at those needs, DBT, which stands for dialectical behavior therapy, and RO-DBT, which stands for radically open dialectical behavior therapy, and much more. So I hope you'll enjoy this conversation with my teammate at Daring Ventures, Carol Ann Manner. Well, hi, Carol Ann. How are you today?
Hi, how are you doing?
I'm doing great. Thank you for joining me for this. And for those who don't know you, why don't you share a little bit about yourself and what you do?
Sure. I'm Carol Ann Manner. I'm a therapist here at Daring Ventures. I'm an addiction specialist, and I'm a certified sex addiction therapist and a certified multiple addiction therapist, because not only do I treat sex addicts, I also treat recovering gamblers.
There we go. Carol Ann is the longest standing clinician at Daring Ventures besides myself. So, yeah, we've been working together for several years now. And really, Carol Ann is the one who opened my world up to what we're going to be talking about today, which is dialectical behavioral therapies, traditional and a new variety called RO-DBT.
Yep.
So all of this, though, really starts with understanding the concept of biotemperament. So, Caroline, why don't you start out by sharing with folks what is biotemperament?
Okay, well, some biotemperament is everybody has a biotemperament, and it's actually just a genetic and biological predisposition that affects everybody's perception and ability to regulate emotion.
I love it. And when you talk about biotemperament, and when we're talking through cases and clients, what the language that I've learned from you is you talk about people either being on one end or the other of sort of this spectrum, right? So there's a
Mhm.
range, and people can fall along this range, but basically, it's from being really under controlled to being very over controlled, right?
Right.
Yeah.
Uh, Yeah, and it's not. I also think of it along a linear continuum, but it's actually um, a pretty robust series of traits and biological qualities. But yeah, it does sort of go from one one side of things to another side of things with a whole range of things in the middle. And we're in therapy we're used to orienting ourselves towards under controlled things. We're used to trying to be in therapy to try and control a bunch of things that are uh, out of control. But and under controlled individuals usually have a biotemperament where they have a lot of impulsive behavior, or their behavior may be mood dependent, or that they have they're very sensitive emotionally, so that small things, relatively small events happen, but they have sort of an outsized or large emotional response to that. And that's not just because of trauma, or that some sort of life event has taught them to have this outsized emotional response, but that they have a uh, biotemperamental predisposition to being emotionally sensitive to start with.
Okay. So I'm thinking of a graph or a chart or something. I don't know what the exact word is that I've seen before. You showed it to me actually the first time I saw it, and it showed a curve with
Mm-hmm.
that linear line, so folks can fall all along this linear line. On one
Mm-hmm.
side under control, on the other side over controlled. There's a curve. So most people are probably in the middle somewhere,
Mm-hmm.
right? But they
Mm-hmm.
still are on one side or the other of that
Yes.
curve.
Yes.
Right. Okay.
Right.
But then as you get to the tail ends, as you've taught me, that's where we start to see more of the problems pop up. Correct?
Yeah. So as people have um they get out towards the tail, and some of us, myself included, I am more towards the over controlled side of things.
No.
Um, and I have more of those over controlled traits. So I have more detail focus. I am more highly structured. I am more disciplined. And there's a little bit of discipline is good, but there is a point of diminishing returns on more perseverance, more discipline, more structure. And for those of us who are sort of outside what I would call the flexible zone, in terms of over control, adding more discipline, more structure, more perseverance, more detail focusing tends to get us, it becomes less effective with more and more of that we add.
Oh,
But
yeah.
part of that is not because of, trauma or life events. Although having had an over controlled parent who reinforced my over controlled tendencies that I inherited from him, uh, that that did get rewarded, but I
Right.
did inherit a lot of that from, as one does, inherit that from those biological factors from our families.
Yeah. Okay. This is great. So let's just kind of break it down. And you've already kind of named some of the traits or things we might see, but just to be really clear, what would be some signs that someone is on the under controlled side of things? More
Well,
UC, as we sometimes say.
so they might have an outsized emotional response to relatively small events. They might have uh, urges to do things impulsively, not just one or two things, but have a pattern of uh, having a hard time resisting impulsive urges to do things, not just in terms of addiction, but just
Right.
to
Okay.
blurt statements out without thinking.
Okay. And then on the over controlled, the OC side of things, what are some signs that someone might be over controlled?
Uh, they might have um, uh, low emotional affect. They might not have much of an emotional response to things, maybe even not much of an emotional response to kind of big seeming things. And then they have a hard time expressing their emotions. They may be highly detail focused and have a hard time seeing the big picture um, um, or all the details. Um, uh, um, and they might be very restrained, perfectionistic, overly cautious, and maybe even kind of rule governed.
Okay. Thank you. So so let's go back to under controlled people. So those folks who have maybe more bigger emotional responses and more impulse control, maybe looking kind of issues. What's the preferred treatment for folks on that end of the biotemperamental spectrum?
On the
On the
UC side,
UC, on the under controlled UC side.
yeah. And so if something like uh, cognitive behavioral therapy has not worked, because we're going to try that first. But if that has not worked and there's treatment interfering behaviors due to impulsivity or emotional dysregulation, then we might want to try a skills-based therapy like DBT, which teaches mindfulness skills, um, distress tolerance skills, emotion regulation skills, and interpersonal effectiveness skills.
Cool. So just for those who are viewing or listening to this, DBT stands for dialectical behavior therapy, right?
Mhm.
Marsha Linehan is the creator, right? Yes. Okay. And I want to reflect it back. So it's skills based, and there are four sort of domains: reflect, no, mindfulness. I'm testing myself. Distress tolerance,
Mhm.
emotional regulation, and interpersonal skills. So
Yes.
they're actually learning tools like do this step one, step two, step three
Mm-hmm.
to increase their skill in those four domains.
Yes.
Okay. So could you give us an example of maybe one of these skills or concepts that they would learn in DBT?
Yeah. So in terms of like emotion regulation, we would learn first to check the facts. So if I'm having an emotional response, we would name the emotion that, let's say, anxiety is causing us distress, or anger or irritability. We would name it anxiety. I'm feeling really anxious about a deadline that is approaching, and I haven't done the work necessary to meet the deadline. So we're going to check the facts. Is does my anxiety match the facts. Well, yes, the deadline is tomorrow, and I haven't done the work necessary to meet the deadline. Well, that and if the anxiety does match the facts, then we need to do some problem solving because the situation is the problem. If my anxiety is due to um, uh, I'm really worried that there is a spider somewhere in my office and I'm really scared of spiders, then it might or might not match the facts. So actually, I may have to, if it does not match the facts, I may have to go opposite. And we learn the skill of going opposite all the way the feelings that I'm having. And I may have to go opposite those feelings in
Okay.
order to repeatedly all the way to reduce my feelings of anxiety.
Yeah. And I'll just say this is one of those DBT tools going opposite that I've sort of picked out from that toolkit, and I use it quite frequently with clients who, they're having an emotional response. It's not going to be helpful. It's not going to get them. It doesn't match the facts. And I'll coach them to go opposite. And at first they'll be like, why would I do that? Like what are you talking about? They'll look at me like I have a third eye. But what is so powerful to me about that is when they do go opposite, how quickly the feelings or the emotions follow.
Yes,
It's remarkable. It
it is
really is.
remarkable.
I mean, within
Yeah,
like a matter of seconds sometimes. Not
thank you.
always that fast, but it can be.
Thank you. Sometimes just naming the emotion can have an emotion
Hmm.
regulating effect. Sometimes just checking the facts can help regulate our emotions. And as we go through the skills and acquire new skills and practice them day after day, they become so natural and we overlearn them over time that they become second nature to us. And then we don't even have to think, oh, what do I do next? What are the steps to go opposite, this emotion or
Right.
whatever? They just become automatic. And that is what we hope clients will eventually do is acquire these skills and that they will become overlearned and kind of natural.
Okay. So let's say someone is like, man, that sounds like that might be really useful to me. What does DBT actually look like? How's it set up, sessions, group skills, how long, all of that stuff.
So in comprehensive standard DBT, um, a client will meet with an individual DBT therapist on a weekly basis, and they will also go to a DBT skills class where are two co-facilitators that run the class. They also, a third aspect of comprehensive DBT is that there are coaching calls.
Mm.
So clients can text or call their DBT therapist to for short like 10 or 15 10 5 10 15-minute calls to apply their skills in real time. So if they're in trying to apply a skill and they're like in the situation and they're trying to figure out how to do it or they're uncertain which skill to use in real time, they can do a coaching call with their therapist and figure out how to do that. But those are not therapy calls, they're skills based calls. And then
Okay.
there's a fourth aspect of standard DBT that are kind of opaque to the client, but they still benefit the client, and that is the DBT therapists meet and have a team meeting each week to build their own skills behind the scenes, and that is occurring each week.
Wow. Okay. Very cool. And okay, let's move to the other side now. So we're sliding to the other side of that spectrum over to the
Mhm.
over controlled or OC side. And can you talk about the preferred treatment for those folks over there?
Yeah. So that is a newer skills-based treatment called RO-DBT, which stands for radically open DBT. And it was developed where standard DBT was developed by Marshall Linehan. RO-DBT was developed by a gentleman named Thomas Lynch. And both of these treatment modalities, by the way, have been validated by randomized controlled studies, which is like the gold standard of validity and reliability in social sciences. And what Dr. Lynch was able to do was to develop a skills-based intervention for people who were had maladaptive perfectionism and were kind of were biotemperamentally over controlled.
Okay.
And it's the same kind of thing. So we meet with our clients once a week for individual therapy, and they also have a skills-based class that they go to with other over control clients and learn skills
Okay.
together.
Okay. And it also has 4 domains, correct, of sort of skills. And are they the same or slightly different?
No, they are still the same, but in RO-DBT, we're learning actually how to become more flexible, open, and to have more connection with others.
Okay. Okay.
Yeah.
So same domains, but there are some differences, and this is where I defer to your expertise. Like the way you teach mindfulness to someone who's over controlled is different than the mindfulness taught to someone who's under controlled. Is that
Oh, I
right?
hear you now. I'm sorry. Thank you. Well, the we still do learn mindfulness skills in RO-DBT. We still do learn the basics, which is, observe with integrity and to participate without planning. And we learn to oh, sorry, I observe and describe, and to describe as well. But um, the skills are slightly different, and they're another key aspect of RO-DBT is learning self-inquiry. So we really do teach RO-DBT skills clients to, when they experience distress, to identify that they are in distress and to ask questions. What is it I might need to learn from this, and to flexibly respond. Yeah.
Okay. Thank you. Thank you. So, how about an example of an RODBT's concept or skill? You gave us one for the
Um,
DBT. Let's hear an RO one.
yeah. So from the example that I used earlier when I was thinking about anxiety, so let's there's a lesson on shame. So when for instance, if we identify that we're feeling guilt or shame or one of the self-conscious emotions like that, we may want to pause, do some self-inquiry, and identify whether the shame is warranted or not. So sometimes shame is warranted. Here at Deering Ventures, a lot of our addicted clients have done things that have warranted
Sure.
shame. They feel things that they've done things and feel shame in response to that. Okay, that makes sense. So the skill set um, for dealing with shame is, if we have discovered through self-inquiry, oh yes, this shame is warranted, then the skill set is SAGE. Flexible mind is SAGE. So The S stands for, engage in self-inquiry to see if it is warranted. A is if the shame is warranted. Appease, meaning we would want to do something to repair the rupture that occurred as a result of whatever the behavior was that was harmful. But it turns out that a lot of the shame that we feel is unwarranted.
Uh-huh.
So if I'm feeling shame because I'm going to disclose to you, Jake, I am 5'2", and sometimes I feel
Mm.
shame about that. but
Oh,
but really, that
yeah.
I it just is what it is, and acceptance is the answer. So,
Uh-huh.
and be that as it may, sometimes my shame about my height is unwarranted. So the G stands for go opposite unwarranted shame. So if I'm feeling shame about my height, I just go opposite and act as if I've done nothing wrong because I didn't do anything wrong in terms of
Yeah.
my height. And the E in SAGE is signal embarrassment. I might be a little embarrassed because of my height. I might feel a little embarrassed if I have to get a stool to stand in to read something on a high shelf, but really that's all it is embarrassment. And when we signal embarrassment, we're letting other people know. It actually, embarrassment is kind of endearing. It lets people, it's actually socially engaging. And so but that's very different from signaling shame. We
Right.
want to hide, and shame causes us to lie. Unwarranted shame causes us to lie about
Yeah.
little things that are not shameful, which is,
Right.
yeah, it's the source of a lot of unnecessary lying about
Yes.
things that are not shameful.
Yeah. Wow. Yeah, that's great. And as where you really sold me on these two treatment modalities was when we had some kind of complicated cases coming through the doors where we'll say treatment as usual, what we had just always done with sex addicts wasn't working. And it seemed like they needed more, like there was more going on. And that's when you introduced me to these modalities. And we've had some really amazing results. I mean, that's what really sold me was seeing some of these clients who had not met their own goals and objectives for treatment start meeting those as a result of doing DBT or RO-DBT. So can you talk for a minute about how these treatments potentially fit in for clients who are coming in for whether it's sex addiction or gambling addiction or betrayal trauma? Kind of how do you see these fitting in for those folks potentially?
Yeah, so
You know
the
what I'm thinking of? Sorry, it just popped
go
in my
ahead.
head. I'm thinking of your triangle. Uh,
Oh, okay.
that just popped in my head.
That's quite right. Yeah, let me get a pen. So, yeah, I mean, clients don't come here with a presenting issue of, can you help me with my biotemperament?
Right.
Right.
Never had seen that one on an intake form.
Not
Yeah.
happening. So people arrive here with their presenting issue is either, can you help me? My loved one is struggling with sexual behavior that is harming me or my family, or I have sexual behavior that's harming me or my family. Okay. And so the addiction, most of our clients on the addiction side, they meet criteria for either compulsive sexual behavior disorder or gambling disorder, and that is we can treat that, and here addiction affects others with betrayal trauma. And that is what we treat first, because that is the presenting issue. But in time, that can get solved. Solved. People with addictions are, a cucumber becomes a pickle and they're always a pickle, but they can be a sober pickle, right? And so, and betrayal trauma, the good news there is trauma reactivity can be reduced greatly, and people's suffering as a result of betrayal trauma can be reduced quite a lot. And families can be restored to it's not going to go back to the way it was, but it can be restored to something new and much more honest and real and authentic. And that's awesome. And they go through disclosure and maybe even multiple follow-up polygraphs. And then there's some underlying co-occurring disorder. I'll even call it a co-occurring something.
Right. Yeah.
That was the painful necessity for the creation of the addiction, right? And the reason that we say co-occurring is because it really was occurring at the same time as the addiction. And
right.
addicts get sober from the addiction, and then now it has unmasked that co-occurring something, which we're seeing full on. And the betrayed partners and spouses, they're saying that is that, which they, no shade on them for thinking this is part of the addiction. And we want to help partners and families understand that, yes, this was occurring along with the addiction, but it is separate from the addiction. And this something could be PTSD, could be generalized anxiety disorder that has been refractory, depression that has been refractory, meaning it has not just occurred once or twice during an addict's life, but it has been episodic across their life course, right? Or there have been personality traits or disorders, could be one, could be more than one, that has, especially in these hard to treat cases where there have been many failed attempts at stopping. Yes. Maybe they've been to several treatment centers, several different addiction, several therapists, multiple attempts at trying to stop, but this co-occurring something has been hard to identify.
Right.
And so once we get them stopped again, now we really want to address this something, whatever that something is. And we want to address it in a sustainable way, right? Mm-hmm. Where we provide not just something for the moment, but something on an ongoing basis that will address the original thing. Because the addiction is not the original thing. This is usually the last thing to develop. And it's a very ineffective way that addicts, usually as kids, have tried to deal with this something that has been going on all along. Beneath this something is biotemperament, which everybody has. And sometimes the biotemperament is the source of the something.
Wow. So sometimes okay, I got what you're saying. Just the genetic disposition that we have toward these things from that can come that other something in that middle layer of the triangle. Yeah.
Yes.
And so it doesn't have to be, and this is an important message because I will admit I've fallen down into this hole before. It doesn't have to be, oh, there must be some childhood trauma that he's not remembering, or oh my goodness, there must have been this or that or the other. Sometimes this is just a biotemperamental reality, that has then sort of grown into or developed into this co-occurring something, which was then eventually sort of attempted to be regulated or managed by the addiction.
Yes.
Yeah.
And imagine the pain of a child who has a biotemperamental sensitivity or a biotemperamental vulnerability that is then compounded by long-standing trauma. That is a double whammy.
Sure.
Think of that.
Sure. And even as we're talking about this right now, I've got names and faces of some of our clients coming to mind. But what I want people to hear is that I have seen people come in who have, this is their 8th, 9th, 10th stop in the treatment journey, and things haven't worked. They haven't been able to stay sober. But once we start treating that second layer, once they get in with Carol Ann and her team and they're doing RO-DBT or DBT based on some assessments that y'all do, they actually get relief, not just from the acting out, but these other areas of suffering that they've experienced, usually in relationships, I would say. Also there's an internal struggle as well that I know these skills help with as well. So, okay, thank you.
You're
Yeah.
welcome. I also want to say that hats off to the partners and spouses who not only are standing by these while the addiction treatment is going on, and while the treatment for these other co-occurring disorders is also going on, which is a much longer process and which also affects them. And I want to say that at Daring Ventures, we are really working on developing additional language to support that, because we have great language for describing betrayal trauma and the effects of betrayal trauma on betrayed partners and spouses. And we want to also have really good vocabulary for the experiences of partners and spouses who are also learning to support their partners who are struggling with these other more complex co-occurring disorders that are much more long-standing, because that is also a process in and of itself. So I wanted to say that.
Yeah, I appreciate that because it does dawn on me. We've talked a lot about addicts and their treatment, but I have seen these modalities really help betrayed partners as well, because like you said, we all have a biotemperament, right? And so if you're a betrayed partner listening to this and you think to yourself, man, I've done the workbooks, I've been in the groups, and well, I could use some distress tolerance skills. I could use some emotional regulation skills. As we're talking about this isn't just for addicts. This is stuff that, I mean, I use the skills as I learn more and more of them. They come to my mind in my daily life. And so if you're a betrayed partner and you've kind of been through it and you're not finding relief, this might be a modality. Go and get assessed. Let's see what your biotemperament is and try to onboard some skills for you that could help bring down your suffering.
Yeah. Thank you. Because biotemperament is just something we're born with. And we really take a non-judgmental approach to, just as we would be non-judgmental about right-handedness or left-handedness or eye color or whatever, right?
Yeah, right. Very good. Well, so Carolyn, if someone, well, you're a licensed clinical social worker, so you're restricted to folks within the state of Texas as of right now. So, but if someone were to want to work with you or reach out to you, um, you would just have them probably call our front desk or email our front desk. That's front desk at daringventures.com or 855-602-2554. But let's say someone's from outside the state. Can you point them to some websites or directories for DBT and RO-DBT?
I would just Google DBT, find a therapist, RO-DBT, find a therapist.
Okay, and it'll
North
pop
America.
right up. North America. Okay. And it'll pop up. And I know those directories are out there. I've seen them, so they aren't hard to find. All right. Well, thank you so much for your time, Carol Ann. Appreciate it. And I really appreciate all you've brought to me and taught me and the value you bring to Daring Ventures. I do.
Thanks, Dick. Thank you for being open to this and for believing in these things when I brought them to you. I'm just really so grateful to you.
Hey, you sold me on it. It seemed to work. So it's good stuff. All right. Thanks.